what we were discussing is the etiology of ectopic pregnancy, and we discussed how important this etiology is. Now, coming to the ultrasound findings. When we are talking of ultrasound findings, I would divide these findings into one is uterine and another is the adnexal. Now, from this uterine findings, I will have these findings. Now, first of all, in uterus, I will not see an intrauterine gestational sac. This is the first point. And I can see a pseudo-gestational sac. So the first point is that there should be no intrauterine gestational sac and there can be a pseudo-gestational sac. And this pseudo-gestational sac is seen in about 20%, 10 to 20% of ectopics. No double decidual sign, no yolk sac or embryo, and this pseudo-gestational sac is not as eccentric. It is within the center. So this is what is written, not eccentric. Those who are taking or have taken over early pregnancy course, they are understanding what I am saying, that this is not in the center. This is not in the away from the center. This is in the center. Why? Because this is the fluid collection. Fluid will come into the center because center is the dependent part. This is discussed in early pregnancy course in detail. So the point here is that from uterine, I will have no gestational sac. A pseudo-gestational sac can be seen, and how to see for this pseudo-gestational sac, we will go in detail within next 2-4 slides. Now, from adnexa, I can see a non-cystic mass. This is called a Blob site. Non-cystic mass. Now, this non-cystic mass, if I will be pressing by to my vaginal probe, I mean the TVS probe, it will move separately. Separately from what? From ovary. So that is called a sliding sign. So see for this sliding sign, when you are pressing by the vaginal probe gently against the ectopic, it moves separately to the ovary. And this is the appropriate sign, and the sensitivity here is 85% approx, and the specificity is about 100%. So keep this sliding sign in your mind. Now, there can be a bagel sign also. What is that bagel sign? First of all, get an idea, then we will discuss each and everything what this bagel sign is. So bagel sign is actually the decidual reactions around the gestational sac. So whatever decidual sign, decidua I am seeing are surrounding the gestational sac is called as the bagel sign, and sac and embryo can be over present. But here is the point. The corpus luteum, if present, will be seen on the same side. This is very, very important. Please make a red note in your notebooks that if I am seeing a gestational sac, if I am having an ectopic pregnancy on the right side, where will be the corpus luteum? Left on the right side or on the left side? Now, this is the importance of knowing your theory. Then later on, we will implement it on ultrasound. So this is the importance of theory. Now, theoretically, if the corpus luteum is on the right side, what is the corpus luteum? Corpus luteum is the ruptured follicle. And if it is on the right side, I will be expecting the ectopic, if in this case, on the right side only. Why on the left side? Unless and until there is the transmigration of the ovum. So if you see a cystic, now the point is, if you see a cystic lesion on the right side, in addition to the corpus luteum, your confidence is boosting. You will think, oh my God, why another cystic lesion on the same side? It can be ectopic pregnancy. Now see the importance of knowing theory. So, vagal sign, blob sign, adnexal sac with fetal pole, if seen, is the most specific. But the point is, this sac with fetal pole is not seen in more than 20-25% of cases. And if seen, it is straightforward diagnosis. So this corpus luteum is a very useful guide when looking for the ectopic pregnancy, as present in 85% of cases in the same side. Now let us see the ultrasound pictures of what we have discussed. Now, if I see a cystic lesion, what is this over here? What is actually this? What is this? Don't indulge in this. Vagal sign, blob sign, sliding sign. Forget about these fancy terms. What actually this is? What is this? What is this? Please comment in the comment box. What is over here? This is the gastrical sac. Uterus is over here. This is the endometrial cavity. This is in the adnexa. This is somewhere in the adnexa. Now, what is surrounding this gestational sac over here? In your comment boxes now. What I am seeing surrounding this gestational sac over here? Decidual reactions. Very good. So now this is the hyperechoic ring surrounding the gestational sac. This gestational sac is like a leech. Wherever it goes, it stucks over there. So whenever it stucks, I can see it on ultrasound that this is stuck over here by having the decidual reactions around it. So this is one point. If I am seeing the decidual reactions over there, I will be having more of confidence now that I am dealing with not a cystic lesion now, but stuck over, implanted over gestational sac, which is reflected by these decidual reactions. So this is this vagal sign, hyperechoic ring around the gestational sac. So see this ring sign or this vagal sign, a hyperechoic ring surrounding this gestational sac over here. So this is boosting the confidence that I am having not a cystic lesion over here, but a gestational sac with these decidual reactions. Now, if I will put color, now see, if I will put color box on this cystic lesion having this decidual reactions over here, what I will expect? I will expect here that the flow should come. If it is a gestational sac, so next point is that I will be putting the color Doppler. So if there will be flow surrounding this cystic lesion, that is further boosting my diagnosis. Now see, the point is what I started with, I have to put each and everything in one basket. So now I am putting things in one basket. Then I will conclude whether it is ectopic or this is not an ectopic. This is the point. So I am putting these things in basket. You will be pointing down, you will be penning down in your notebooks these points. So first thing is the vagal sign, this hyperechoic ring surrounding the gestational sac. Second is I will be putting the color Doppler, and if there is vascularity around the gestational this cystic lesion, that is also favoring the gestational sac. Now, how to differentiate it from the corpus luteum, because corpus luteum will also have the increased vascularity that we will discuss later on. So these are the 2 points which you have. But before these 2 points, you have to pen down that there is something which is called a sliding sign also. So 3 important points we discussed till now. And before that, etiology, because etiology will give you clue that you may be dealing with an ectopic pregnancy. So how many important points? 4 till now. Now, there is something which is called as specific for ectopic. Specific for ectopic. That is, if you see an embryo in adnexa, nothing to think. No points to put in your basket. It is already full. Your basket is already full with this 1 point only. But not always you will be seeing this embryo in the adnexa and with the fetal heart pulsating over there. That is why we will be seeing more of these less specific points. That is empty uterus, adnexal mass, free pelvic fluid, pseudogestational sac. So something which is specific has nothing to think more, but less specific have to think more. So less specific points is empty uterus, adnexal mass, free fluid, and a pseudogestational sac. Let us discuss this pseudogestational sac. Now, everybody knows the pseudogestational sac, but I am sure that not more than 5% of candidates are very clear with this pseudogestational sac. Let us clear first the funda, what this pseudogestational sac is. To clear, I have only one example which took me about 2 decades to quite, and it will make you understand for rest of your life what this actually is, this pseudogestational sac. Let's assume we are having a bucket. Pay attention to this example, very beautiful example, which took me about 2 decades. And there is no better example than this to make you understand what this pseudogestational sac actually is. Now, let's assume that we are having a bucket. In this bucket, I will be putting a ball. I mean the water ball or any ball. Let's take water ball. So I am putting a water ball in the bucket. Question: will there be space in between this water ball and the bucket? Yes, there will be. I am again repeating. This is very important point. I am having a bucket, and in this bucket, I am having the water ball. The point is, will there be space in between the walls of the bucket and this water ball? Yes, there will be space. But the point is, if I will be having a bucket with not a water ball now, but direct water in it, will there be any space in between this bucket and the water? The answer will be no. Now, this bucket with the water ball is a true gestational sac. This bucket is the uterus, and this water ball is the gestational sac. I mean the true intrauterine gestational sac. Here, the bucket again is the uterus, and this water in this bucket is the pseudogestational sac in the uterine cavity. I gave a 5 seconds pause. Now think yourself how this is applicable over here. If there is a space in between this bucket and the water ball, this space should be reflected over here, and that is called as unobliterated uterine cavity. So if you see unobliterated uterine cavity, there is no point of having a pseudogestational sac. But if the unobliterated uterine cavity is absent, it means that water is getting filled with the walls, merged with the walls of with this bucket. So I will be having no unobliterated uterine cavity over here. Now, here we need a strong understanding of unobliterated uterine cavity. We have discussed it in detail in our early pregnancy course, which we are taking on our server. which our candidates who are registered with us, we are not taking a course right now, we are taking a virtual CME. We have discussed and we are discussing an early pregnancy course that there is something which is called unobliterated uterine cavity. Now, for example, there is a uterine cavity, and for the sake of argument, if uterine cavity is 10 cc and there is a small gestational sac, will this small gestational sac, how much will be the small gestational sac? Will it be 10 cc or less? It will be, of course, less. How much it will be? Less. For example, for the sake of argument, if it is 2, if it is 3, if it is 4, if it is 5, I mean very early gestational sac, not the grown up. Because if it is grown up, till then the ectopic signs will be more clear. Now the point is, coming back to the early pregnancy, if for the sake of argument there is 10 cc of endometrial cavity and the gestational sac is 1 cc only or 2 cc max, what is where this 8 cc has gone? It is over there. That is unobliterated uterine cavity. How that is seen on ultrasound, that is different part. That is the part and parcel of our early pregnancy course. I will discuss a bit over here. So the point is, if I will be catching this unobliterated uterine cavity, am I ruling out ectopic pregnancy? Yes. So keep this point in your mind, that if I am having a bucket with the water ball, that is the unobliterated uterine cavity, that is the intrauterine gestational sac, and I will be seeing this unobliterated uterine cavity. This is the sketch of this unobliterated uterine cavity. How this is reflecting on ultrasound, I will show you later on. First, take the concept. And if I am not seeing any unobliterated uterine cavity, I am dealing with a bucket with the water. Now, that is point number one. Point number second is that, this gestational sac will not be in the center. If it is true intrauterine gestation, it will not be in the center. But if I am dealing with the water, where will be more water? Towards the center or away from the center? Keep in mind the gravitational point also. It will be in the center. That is what we discussed it. Not in center or in center. So if it is not in center, that is going a green signal for me, not in center. But if it is in center, it is going a red signal for me. It may be the case of ectopic. So this is the point. Now, how this is looking on ultrasound. This bucket, now see, this is the bucket over here. This bucket is having a water ball. This is an unobliterated uterine cavity. So if I am seeing this unobliterated uterine cavity over here, it means actually I am seeing the space in between this bucket and the water ball. This is unobliterated uterine cavity. This, in other words, you call a double decidual sign. What is double decidual sign? We are discussing this thing again in early pregnancy course. 2 deciduas, one coming from the decidua parietalis, one coming from the decidua basalis. So that actually is nothing but the reflection of this unobliterated uterine cavity. So the point is, if you see unobliterated uterine cavity, you are dealing with a bucket with the water ball, and that is the true intrauterine gestational sac. But this bucket is having fluid. No question of having unobliterated uterine cavity. No question of having any space in between water and this bucket. So this will be a pseudo-gestational sac. So I hope that your pseudo-gestational sac is clear. So this was the concept of pseudo-gestational sac. Now, question. If I am teaching for 10 seconds, not 10 seconds, 10 minutes, I will expect the reply on 11th minute. Now question. This is the true gestational sac. This gestational sac is over here, I can see. Now, the point is, it can be a round, oval, anything, round or oval, but is. Now question is coming, but before question, take the points. is this uterine cavity also oval or round? No. How is the uterine cavity? Uterine cavity is more toward the fundus and less toward the cervix. So this is tapering toward the cervix. Keep this point in your mind. Uterine cavity is tapering towards the cervix. So the nature of the fluid is that it will take the shape of anything in which it is kept, be it the bucket, be it glass, be it cup. It will take the shape of the thing in which we are keeping the fluid. Now we know that this pseudogestational sac is nothing but the fluid collection in the endometrial cavity. Question: is uterine cavity round or oval? No, it is tapering towards the cervix. Will this fluid, I mean the pseudogestational sac, will this fluid also taper towards the cervix? Say yes or no in the comment box. So question is only yes and no. So the question is, if I will be having a pseudogestational sac, in other words, if I will be having a fluid in the endometrial cavity, will it taper toward the cervix? Hurry up, hurry up. Yes, 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 yes. So I got about a 30, 40 yeses. This is over here in the comment box. Now the point is, if I will be able to see this tapping toward the cervix, is it boosting my diagnosis that I am dealing with the pseudogestational sac? Yes. Now, what is this called as? This tapping. What is this called as? This is called as dash dash sign. What is that sign? Anybody? Anybody? Yes, Dr. Asha. Good. Big sign. Dr. Ujwala, big sign. Very good. Now see, the point is that you should know the things. You should not just know that this is the blob sign, this is the big sign, this is this sign, this is that sign. No. You should know the funda. Now, if you know that this will taper toward the cervix and this tapping is called as big sign, this will be again one thing which you will put in your basket. Now, put this one thing in your basket also, that I should see a big sign in case I will be having a pseudogestational sac. And another thing which you have to put in your basket is that I will not see any unobliterated uterine cavity. And if I see any unobliterated cavity, it is ruling out. Now see, there is something which is called as suggestive, and there is something which is called as ruling out. Now, if I am having this unobliterated uterine cavity, it is not suggesting of something, it is ruling out each and everything. It is ruling out ectopic pregnancy. Now, whatever you have put in your basket is taken from your basket and throwing out from your basket in the dustbin. Nothing to think. So this is ruling out. So put in your mind that there is something which is called as suggesting and something which is called as literally diagnosing or ruling out. So if you see, the point is, if you see this unobliterated uterine cavity is ruling out ectopic pregnancy. So if you see a pseudogestational sac, and in pseudogestational sac, you should see a big sign, which is nothing but reflecting the contours, of, I will not say contours, the shape of the endometrium. So keep in your mind and put it in your basket that we are having something which is called as big sign, and that big sign is nothing but the reflection of the endometrial cavity shape. So there is something which is called as heterotrophic pregnancy. Keep this thing in your mind also, because with a lot of these ARTs, we are having now these heterotrophic pregnancy. The point here is that when you see a gestational sac in the uterine cavity with a fetal fold, with a pulsating heart, don't get happy. Think on lines of heterotrophic pregnancy,